Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth, so I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello and welcome to Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart, your host, and today we are very blessed to have a great guest with us, Kimberly White. She is an oral myofunctional therapist. She's also a speech pathologist. I guess she's first a speech pathologist and then has a subspecialty in oral myofunctional therapy. And you might wonder, what is oral myofunctional therapy? Well, you're going to find out today. It's actually very important. You know, in our practice, in our dental practice, Dr. Corridor and I, we are dentists by training, but we also do so much more than that because the optimal health and the start of health really is through the mouth. If you think about it, what are the two things that we do that we need that we cannot live without? One is eating and drinking, which is through the mouth. The other is breathing, which is through the nose and secondarily through the mouth. So the mouth and the oral structures play a huge role in a person's overall health, not only their dental health, but their overall health, their development, their self-esteem. People over the years, Dr. Corridor and I both have restored people that have missing teeth or broken down teeth, and we work with them to restore the health to their mouth and their body. But in doing that, we give them these beautiful smiles, and it transforms their lives. But you know, we don't think about things like a child with a speech problem. You know, how it's cute when they're 2 and 3 and 4, but when they start getting 5, 6, 7, they start getting teased about it at school, and it starts to become very important to them that they have this speech issue corrected. That's one of many things that a licensed speech language pathologist does. And when you add the oral myofunctional therapy to that, then what we're basically doing is therapy for the oral structures to promote a very healthy life. So I'd like to introduce Kimberly White. Kimberly, welcome.
Thank you. Thank you for having me.
Great to have you here. Kimberly is also a colleague. I refer to her and she refers to our practice on a regular basis. So we treat a lot of patients together. So we're kind of like the A team trying to get for the betterment of all society. We love working with patients, and that's one thing I really appreciate about Kimberly and pretty much all the oral myofunctional therapists and speech language pathologists that I've met. They have a true caring for human beings, and it's a career and it's the way you make your living. But first and foremost, it's your caring for humans, and that's what we're all about too. So thank you for being here today. Why don't you tell a little bit about yourself, and so our audience can know who's coming at them today with all this wonderful information.
Great. Well, I've been a speech pathologist for 29 years. I absolutely love what I get to do every day. I wake up, it's never boring. It's something different every day. But about 7 years ago, I looked at my patients. I'm like, they're in therapy too long. Why are they here? And that sent me down the rabbit hole of myofunctional therapy, because kids should not be in therapy forever.
Yeah.
You know, you see some kids who, like you said, when they're little, they can't make their R's. It's kind of cute. But once they're, 4, 5, 6, they should be able to say all of their sounds. If they can't, it's going to impact their self-esteem and their self-confidence and how they interact with others, how they interact with the family. And eventually they're going to think, why am I still in therapy? My brother doesn't have to go. My sister doesn't have to go. Why am I still here? And I made it my mission to figure out why. And I eat, sleep, and breathe myofunctional therapy now because it has changes lives.
Yeah.
It's fun every single day.
I think probably most of our viewers, when they hear a licensed speech pathologist, that's somebody with speech problems. What is, rhetorically, I know the answer to this, but tell our audience, what is oral myofunctional therapy? What does that involve and why is it important?
Good question. Orofacial myofunctional therapy has everything to do with the lips, the tongue, and how structure impacts function. So when somebody comes to me, I'm not just listening to their speech and how does it sound, because it can acoustically sound okay, but where are they placing their tongue to make those sounds? Because if they are consistently pushing their tongue against their teeth consistently, that's going to change their dentition.
Yeah.
I look at how they eat, how they swallow, how they chew, and are there a lot of compensations? You know, kids who come to me who are messy eaters or drool or eat with their mouth open or smack, those aren't just bad manners. There's a reason behind that. And
Yeah.
I love to pick that apart and help kiddos and help adults.
Yeah. Well, you know, and you said something really important. Those aren't bad manners. But if a child is told that, oh, you're sloppy, you're a pig, those are bad manners, you're so rude, that has a psychological effect, and it's something that they really can't help. I mean, they can do their best to eat, you know, nicely and not get things all over the table, but if they functionally can't do it, they can't do it. And then it's a struggle. Then it becomes a psychological issue as well.
Or they might become aversive to certain textures, or what seems like parents will say they're a picky eater. They're a picky eater for a reason.
Yeah,
Let's figure
yeah.
out why. Usually they're a picky eater because that structure impacts function.
Yeah.
Maybe they know they can't tolerate certain textures in their mouth, or they can't chew it well. They can't get into a cohesive bolus to swallow it. And so they're the kids who only eat soft things.
Mm-hmm.
Kids should not be eating soft things.
Right.
We're growing a face right now. They need to be chewing.
Right. Yeah. I always say to our on previous podcasts to our audience that eating soft food all the time would be the equivalent of just sitting on your couch all the time and then expecting to be able to go out and run a marathon or to be able to do anything athletic at all when all you do is sit on the couch. If we don't eat correctly, the way that we eat, the consistency of it is just as important as the nutritional value of it.
Absolutely.
But ironically, the foods with the most nutritional value are the ones that you actually have to work for and chew.
Ones you have to chew. It's so common. I'll ask a kiddo or an adult, tell me foods you don't like to eat. They're all the things they have to chew. And parents will say, oh yeah, they eat chicken nuggets. Well, chicken nuggets, you really don't have to chew it.
Right.
It's just already ground up meat with a little wrapper around it.
Right,
You put a
exactly.
piece of steak in front of them, or a pork chop, or an apple even.
Yeah.
They won't do it.
Yeah.
It's hard.
Yeah, an apple that you actually have to bite into and chew,
Exactly.
not one that's pureed up out of a
In a
Gerber.
pouch.
Yeah, or with the pouches.
Right.
So I've been treating temporomandibular joint disorders for almost 30 years, and I came to the realization after always researching the best technique, the best treatments, the different effects that drugs and our bite and has on the TMJ, that one of the reasons that people have headaches and pain in their jaws and even their neck is because the muscle tone is not, they don't have a coordination of muscles. And so that while that's one part of the puzzle, it's a very important part.
Right.
So that's really what oral myofascial functional or therapy is. It's not making things stronger.
Right.
It's about creating
The
tone and neurologic response, right?
Absolutely, and coordinating all those muscles and reflexes together
Yeah.
to work the way we were designed to work.
And being a licensed speech pathologist, how does that work into someone? Like I do a lot of surgical tongue releases with people with tied tongues. And so all of the patients must work with a myofunctional therapist before, during treatment, and after. So I know that I send you patients for that. You send me patients that you have to evaluate their tongue. What are things that parents could look for, or adults in themselves, to think, hey, I might benefit from this?
Right. Well, when we're talking about kiddos, I always encourage parents, I'm like, just study your child. Be a detective. Look in that rearview mirror. When they're just looking out the window, what is their mouth posture? They should be breathing through their nose. Their lips should be closed. A lot of times you're going to see this mouth open wide.
Yeah.
Okay, that mouth is open wide, that tongue's not where I want it to be. That tongue should be lightly suctioned up to the palate. But a lot of times if kids cannot exclusively nasal breathe, that mouth is going to be open. So they're going to have low tone in their tongue. That's going to impact speech sometimes.
Yeah.
Not always, but sometimes it's going to impact speech. If they're noisy breathers, that's something else too. They should not be noisy breathers. They shouldn't snore. Some other signs and symptoms that people don't recognize are they restless sleepers? Are they wetting the bed late in life? There's a reason for that. When they wake up in the morning, does it look like an alligator's been in their bed all night? I'll always ask kids, how do you sleep? They're like, oh, I sleep good. I'm like, okay, is your bed all nice and straight when you wake up? Does it look like an alligator slept in it?
The sheets have been in a blender.
Oh, absolutely. Because those kids are not getting good sleep.
Yeah.
We're growing a brain right now, and they have to have good sleep.
And so a lot of people, being a specialist in sleep disorder breathing and growing healthy jaws for healthy airways, a lot of people think, what does breathing through your mouth have to do with sleep, and why is that important to breathe through your nose? So what are your thoughts on that?
Well, we want to develop good tone in the lips, because the lips are the retainer for the teeth, right? So if the lips are always open, that tongue's going to be down low and forward. We shouldn't have to wear a retainer forever. I tell kiddos or adults, you can have this handsome smile, but get those braces off. But if we don't correct how the function of the tongue, your teeth are going to move back.
Yeah.
And nobody wants that to happen 2 and 3 times.
It makes perfect sense. You've got the lips and cheeks pushing one way on the teeth. You have the tongue pushing the other way. And if those are balanced, then that maintains a perfect retainer, basically, after orthodontics. Yeah.
Because we want to make sure we're swallowing correctly. If someone has a tongue thrust, that tongue's consistently pushed on the back of the teeth, that bite's probably going to open back up again. So we want to correct that tongue thrust.
Yeah. So people with TMJ issues over the years, a lot of the times their complaints are headaches and just facial muscle tension.
Right.
I had one patient I distinctly remember because I went to her sister's wedding, and when she got up, she was the bride. Is it the bride of honor or the
maid of honor?
The maid of honor. Yeah. Not the bride of honor. Her sister was the bride of honor, but she got up at the receptionist and to make a speech, and she talked about how her sister and she, when they were younger, would sit on their bed and just laugh, and they thought everything was funny, and they would have such a great time laughing. And she said, but I often would have to stop laughing because my face hurt so bad, but not anymore after seeing Dr. Stewart. So I got a plug at the wedding, which was great, but I wasn't intending that. But my question is, I see that a lot, and I used to think that, well, it's all because their TMJ is not seated and they've got a bad bite, and that plays part of it. But myofunctional therapy, I've come to learn that plays a huge role in getting people comfortable. So if somebody doesn't have the proper muscle tone of their tongue and their lips, how does that translate to discomfort with them, like facial tension and headaches and things like that?
A lot of times patients will have headaches because they clench and grind their teeth. And if you really think about it, when you clench and grind your teeth, you're opening up your airway. So if you're doing that all night long, it's not normal to wake up every morning with a headache. We need to get to the root cause of that. And so usually their tongue is not where it needs to be. Your tongue should be resting lightly up in your palate. If you're clenching and grinding all night or all day, your tongue is down low. So you're not going to develop that tone and the strength that you need in your jaws.
Yeah. So again, it's part of this rather can be complex puzzle of people that, have clenching, grinding, airway, muscle tone, headaches. People out there might think, where do I start?
Sure.
And I would tell them this. I would tell them to go to an airway-centered dentist, because dentistry really is leading the charge on airway.
Right.
Medicine's kind of following behind. There's more interest in it. But ask your dentist if they work with a myofunctional therapist, because that's just as important as a car mechanic, working with the body shop. You have your engine fixed, but then you have a wreck, but then you need the body shop to to fix other stuff. So a myofunctional therapist, and a lot of dentists have those in their office. Kimberly has her own practice, so she can really see a diverse, different patients from different doctors and really help a lot of people. So the typical patient that you get coming, say, from a referral, what should our viewers maybe be asking there if they're going to the dentist or maybe to the ENT, questions about their child's mouth? You've given us some things that they should look for, but what are some questions they can ask their doctors?
Well, I would say we need to, if your child is snoring, okay, we need to know why, because that's never normal, right? If they're sleeping, I think more so what questions to ask your doctor, maybe some questions to take to your doctor. Hey, I noticed this in my child. I noticed that they're snoring. I noticed that their mouth is always open. I noticed that they're drooling. You know, past 2, they shouldn't be drooling. Notice they're a really picky eater, or they're a noisy breather, or their head's always forward. They have this, their posture's bad. Why is their posture bad? Well, we need to look at that. There's probably a reason. Their speech is delayed. If they have that slight lisp, maybe, you know, you're going to hear that. It sounds kind of slushy, because kids are going to spell the way that they speak. So we have to look at that. You know, the way they speak is going to impact how they read, how they spell, and how they perform academically.
So the R sound you used earlier.
Yes.
When should a parent be concerned that R is still aw and not R? I mean, I know there's not a magical cutoff,
right?
But
R is hard.
Yeah.
And the more it's habituated, the longer they say it wrong, the harder it is to correct. Okay.
Yeah.
And so
it's like a golf swing.
Exactly.
Like my golf swing.
Yeah. There you go. So you know, by 5, if they don't have R, we need to do something about it yesterday.
Yeah.
And a lot of times the reason they can't do R is not because, let me say this, it's usually because there's something going on structurally inside the mouth. Generally, they have a posterior tongue tie. They can't get the back of that tongue up. It's not just R. There's 32 different variations of R. And I tell parents that, and they look at me, and the kid's like, yeah, R is hard. You know, we got or and ir and and all these different variations.
Yeah.
So there's slight movements. If you can't elevate the back of the tongue like you need to make those, you can be in speech therapy for years. It's not going to make a difference if we don't take care of the structure.
Yeah. That's great advice.
Yeah.
So obvious speech problems, snoring, watching your child if they've got their mouth open a lot. Those are signs that there's something going on that's not normal. So,
and watching them sleep, you know, how do they sleep? Are they little angel? Are they still all night, or do they move around all night long?
Yeah.
Do they have to get up several times in the night to go to the bathroom? Do they sleep talk? Do they sleep walk? You know, that is fragmented sleep.
Right.
And so it's gonna look like behavior during the day. You know, but they're just exhausted.
Yeah.
A lot of kids get diagnosed with ADD or ADHD. That is not the case. Yeah, they may have that, but most of the time they don't. Most of the time they're getting horrible sleep.
Right. And so a child, when they don't get the proper sleep, or maybe they sleep all night, but they're not in their normal sleep cycle.
Right.
During the day, they really are exhausted, but what they do is their fight or flight sense takes over, and they basically are on an adrenaline rush all day just so they can stay awake. That's why when they get mom picks them up from school or kindergarten or wherever, they get in the back seat and they're out.
They're out. Or that's when you see some behaviors, because they held it together at school all day, but they're with mom and dad, they're safe now, and now they can't hold it together anymore.
Right.
They're not behavior problems. They're exhausted kids.
Yeah.
They'll have those dark circles under their eyes. I mean, that's a telltale sign to me when they come in. Dark circles under their eyes, or the asymmetry in their face.
Yeah.
Yeah.
And they, like you said, you get the root of the problem corrected, and a lot of those symptoms just magically disappear.
Right.
They become better students, better children, better friends.
Absolutely. Yeah.
And sometimes I think the solution is so simple that people won't believe it. Not that what you do is simplified in any form or fashion. It's actually magical, but it doesn't have to be a drug, or it doesn't have to be a operation.
Right.
Sometimes it's just training.
Just retraining. Just training them to exclusively nasal breathe, and to keep If it was easy as okay, you need to breathe through your nose and keep your lips closed, go home.
Right.
But it's not. It's a habit, and habits are hard to break.
Yeah.
And we have to get that tone back that we've lost.
Yeah.
You know, if a kiddo has mouth breathed their whole life, or an adult has only mouth breathed their whole life, those are hard habits to break. And that's where myofunctional therapy comes in, is we retrain, we repattern those muscles to work how they need to work.
Yeah. So that's great. One reason for mouth breathing is because of nasal obstruction. So that's, you know, if you take your child to a myofunctional therapist, they're going to, you know, I would like to say any dentist is going to check for that, but actually most don't. Most dentists are, you know, they just concentrate on teeth. We obviously do that, but most, I would say pretty much most myofunctional therapists are going to assess the nasal passages. And then if those are not working correctly, off to the ENT they go.
Right.
And we work very closely with several ENTs. So it really takes a collaboration of professionals. But the oral myofunctional therapist, I tell my patients this, that you may need to go see an ENT, you may need to see an oral maxillofacial surgeon, you may need this, that, I don't know until we assess it. One thing that you are most definitely going to be sent to is Kimberly White, oral myofunctional therapist, because I would say the vast majority of people that I see need that. That's one thing, and I know that's, you know, that's like putting, you know, a fuel enhancement in the gasoline tank of a car. All it's going to do is help things.
Right.
And you know, any advantage we can give our patients, the better.
Absolutely.
So I noticed you brought some goodies.
I do.
Some things that you would do in a typical appointment with a patient. You know a little bit more about myofunctional therapy, why it's important. So we actually have a patient today, my daughter, Alexandra. Alexandra, welcome.
Thank you.
Alexandra works at our practice and does all of our social media and marketing, and she just does a great job. She's pregnant with her first child that will be born in November. So welcome. So Alexandra's really interested in all of this because she's going to make sure that that baby, my grandson, is going to be breathing right and using his mouth correctly. So Kimberly's going to show us some things that she does with her patients and why she does them.
I always have a patient when they first come, I want to know if they can breathe through their nose exclusively. I'll ask, and the parent or the child say, oh yeah, I can do that. I'm like, okay, do me a favor, take a drink, and I want you to hold it in your mouth for 3 minutes. If you have to swallow because you're so hungry for air, when you need to swallow, just raise your hand and let me know. Numerous times. We'll get 45 seconds into it and they cannot do it. And the parent's really surprised, or the breathing gets really, really loud. Okay, that's just one quick, easy way to see, can they exclusively nasal breathe? So we're going to see how strong your lips are today.
Okay.
Okay?
Mm-hmm.
Anything 3 and above is within normal limits, I'm happy. Okay? So what we're going to do, this is not going to hurt at all. You're going to put this in your mouth, you're going to put it in front of your teeth, and I'm going to pull it out.
Okay.
And then we're going to look, and we're going to see what you get.
So she's just
Okay.
holding this with her lips.
Yes, she's
Yeah.
just holding it with
Not
your lips.
biting on it.
No, you're not, because I'm going to pull it out. Okay?
Okay.
Okay. So put this in.
So-
So smile at me really big. Okay, to take the button and put it in front of your teeth, but behind your lips. Smile at me. There you go. Just put it
So
in
like
front of
right here.
Uh-huh.
Like hold it.
Mm-hmm.
With your
Put it behind your teeth.
Oh.
No, behind your lips.
Like this.
Uh-huh. And just don't let me pull it out. We're just going to practice. See? That didn't hurt, did it?
No.
Okay. So we
Yeah, I
practice
feel like I
first.
didn't do a good job.
Well, we're not even going to look at that
Okay.
number, okay? But now, then we're going to do it 3 times and get an average. And this tells me how strong your lips are.
Okay.
Okay. I always check. It's in front of your teeth, right? Okay. So here we go. Hold, 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 hold. There you go.
Okay.
All right.
I don't know if that's good or
It's not. We want it to be 3. We're a little weak, so we want it to be 3 because the lips are the retainer for the teeth, so they should always be lightly suctioned against
Okay.
your teeth. So we're going to do it again. Okay, and hold, 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 hold. Okay, got 2.
Okay.
All right. So then, so I'll get an average, and then I'll always show the patient. Okay, we want to be up here in the blue, right? You're here.
Okay.
So I'm going to give you some exercises to work on your lip strength. Okay, stronger lips are going to help with speech. It's going to help produce certain sounds. It's going to help with exclusively nasal breathing. It's going to help get your tongue up where it needs to be. Because think about it, if your lips are open all the time, your tongue's not going to be suctioned up here.
Yeah.
So I'm going to send this button home with some exercises to do. And then when the patients come back every 2 weeks, we're going to measure and we're going to chart on here. Everybody likes to see your numbers go up, right? I'm going to know if you're doing your homework because these numbers are going to go up. So we want to end up being up here in the blue. So, so this is objective data and one way that we can measure lip strength.
Cool.
So I'm going to give you some homework today. Yeah. Okay. You get a button.
I'm going to have to make an appointment and start biofunctional therapy.
And
so lip strength, again, helping retain the teeth against the forces of the tongue. And that's one reason that it's important. And just overall tone. I would say myofunctional therapy probably helps people look better too, right?
Absolutely.
Yeah, just like your body, the rest of your body, if it stays toned, it's going to look better. And
you know, you think about a teacher who looks out in a classroom, she's going to see the children who are studying with their lips closed or this child.
Yeah.
We shouldn't judge, but peers judge, right?
Alexandra was a teacher.
So
she taught 7th grade, and when I started educating her on this, she said she would see them all the time, right?
Yeah.
Oh, yeah.
And those were those the kids that had a hard time attending and focusing?
Oh, yeah. I would say, I mean, probably about 60% of my students had accommodations because of ADD, ADHD, and were on medication. And I could tell because of what I had learned just from looking at them, it's like, this isn't, and you know, it is an ADHD problem, but it's because you're sleep deprived and now you're on all these medications and it's just feeding the fire.
And they're not getting enough oxygen to their brain because you don't get the oxygen you need from mouth breathing. You close your nose or you close your mouth and breathe through your nose. It makes a world of difference.
I tell my patients it's like you can eat at McDonald's and survive.
Sure.
But if you eat at McDonald's for 10 years and that's all you eat versus healthy homegrown food, and you know, it's a totally different quality of life.
Yeah.
And that's what breathing through your mouth versus nasal breathing.
There's a picture, I wish I had it here today, but it shows two siblings, two twins, and one of them had a gerbil or a hamster in their room, and one didn't. And well, the one that couldn't breathe, his face got longer. You've seen it. His face gets longer.
Yeah, it's one of Dr. Mew's patients from Britain.
Yeah.
From Great Britain.
It's pretty amazing.
What else do you have in the bag here that you use for your patients?
Well,
see, when you go see Kimberly, you get a whole bag full of goodies.
Fun goodies that we're going to have. I'm going to send you home with what you need for any exercises. I try really hard to make the exercises fun. You have to do them. It's not going to be time intensive, but you have to do it. If you want to make progress, you have to do the exercises. So there's something in here that's a QTT measurement. I use this to measure how wide you can open your mouth, and when you put your tongue up on the spot, I measure this to see if somebody possibly has a tongue tie.
Oh, yeah.
Yeah. Do you want us to measure?
Yeah, I do.
Okay.
While you're putting your gloves on there, Kimberly, because I know a lot of our viewers might want to know, what's the earliest age that you work with?
That's a good question. I start seeing kiddos from 18 months and up, but for myofunctional therapy, you really do have to be able to follow instructions and follow directions. So I wouldn't do an intensive myofunctional program with somebody younger than 4. Now there's things that we can do, feeding wise, language, artic wise, but a true just myofunctional case, they need to be able to follow directions and do exercises. So I'd say about 4. It's a pretty good age to start that. All right, so I want you just to open your mouth wide, just as comfortable as you can, but wide. There you go. Look straight ahead. I always measure from the same teeth. Awesome. Okay, now you feel that little ridge right there? That's the spot. So I always tell my patients, we're going to talk about the spot a lot. So I want you to open your mouth as comfortable as you can, but put your tongue right up on that spot. Okay, pull it back just a tiny bit. Your teeth are lava. Never touch your teeth. Awesome. So a lot of times if somebody has a tongue tie, right away I'm going to know it because they're going to jut their chin forward. They're going to have all this extraneous tension in here. You didn't do that. That was awesome. But I see it all the time. They'll come in, their head will be forward, and they're like, here. I always tell little boys, I'm like, you gave me Incredible Hulk neck, dude. They don't mean to, but they do. Okay, so now I want you to suck your whole tongue up to the palate, there you go. Make a deep, dark cave. I think you had said you'd had some upper jaw surgery before. I see that here. So what I'm looking for, you feel that little, like a guitar string under that little frenum there. You're doing that pretty well. So people who are tongue-tied, they're going to really struggle with that. Oftentimes they can't get the back of their tongue lightly suctioned up. those are the kids who can't make good R's. They can maybe do it if they really, really try hard, but in conversation when it's going fast, that's when it deteriorates significantly. So this is just a good, quick little tool. And I like to do it in front of parents. So I have the parents stand in front of me so they can see the big difference from when that mouth is open wide to here, and then they can't even suction. So, and usually the kiddo knows it, or the adult knows it too. They'll tell me right away, oh, I can't do that. I'm like, well, let's try, let's get it. And so I like to have numbers again. Once again, insurance companies like numbers, and numbers let us know when we're making progress.
Yep.
So, yeah.
So those are a couple of the exercises that are in tests that Kimberly uses, among many others. And then you would send your patients home with exercises for them to work on. And these aren't things that they take 2 hours a session. They can work on these while they're in their car, while they're watching TV.
Absolutely.
Yeah.
Yeah, I try really hard to make it, we're all busy. I get that. I'm a parent. So I give kids exercises or adult exercises that they can do throughout their day. I feel like it's not a cookbook approach. It's not just a recipe. So every exercise is tailored. What you may need is not what your dad needs or what Tommy needs. So I'm only going to give you the exercises that you need to get you where you need to be. And so I always tell patients, it doesn't take a long time, and especially even my adults. I will go through the exercises with them, and then I'm going to set the timer on my phone, and I'm going to show them how long it takes. Because you don't realize. And I'm like, okay, that just took 2 minutes and 30 seconds. And then they're like, oh, okay, I can do that. Otherwise, it's overwhelming to leave with a sheet of 3 exercises. But if they see, oh, okay, she wants me to do this 2 times a day, and it's only going to take me 2 minutes, I can get it done.
Yeah.
So I'm going to partner with my patients and their families and meet them where they're at. You know, if they're in the car, we're going to figure out exercises to do in the car. You know, because I want them to be successful. I don't want them to not want to come back and be embarrassed because they didn't get their homework done. That's my job, to set them up for success.
So Kimberly, if a child is in braces or an expander that's already in their mouth, could myofunctional therapy still be initiated with that, or was it better to get, if they've got something in the roof of your mouth, a dental expander?
Sure.
How do you work around those things?
Well, there comes a point where we may have to pause therapy, but there's a lot of things we can do even if an expander is in.
Okay.
And when we get to that spot in therapy, we may have to pause for a little while, but usually there's still things we can work on.
Like you said earlier, everybody's different. Every treatment plan's different.
Right.
Kimberly has an exhaustive new patient exam process that each patient goes through, and it really does individualize it for that patient. So that's rare a lot of times in today's society where everything is, A, B, C, D. It's not always that way. Humans aren't always A, B, C, D in a lot of ways. So.
And I think it's important to find out what's important to the patient too, because they have to buy in. It has to be important to them.
Right.
My adult men especially, they're exhausted. That's what they tell me. I'm exhausted all the time. I'm not the husband I want to be. I'm not the dad I want to be. 10 minutes into therapy, my men are exhausted. Yeah. Because they've compensated for so long. So I have to meet them where they're at. Okay, what's important to you? Okay, this is what we're going to do. This is how we're going to get you there.
Yeah.
It's fun.
That's great.
Fun to make a difference. So.
Well, Kimberly, it's been awesome having you today. We'll definitely have you back. As we always do, we end our segment with a song, because this is health and harmony.
Yes.
And harmony in the body, but we all love music. So what song have you picked for us today?
I chose a Disney song because I'm a Disney fanatic, and it's Mother Knows Best.
Okay, Mother Knows Best. All the mothers out there are going to love this song. Let's hear it.
Mother knows best, listen to your mother, it's a scary world out there. Mother knows best, one way or another, something will go wrong, I swear. Ruffians, thugs, poison ivy, quicksand, cannibals and snakes, the plague, yes, also large bugs, men with pointy teeth, and stop no more, you'll just upset me.
Pointed teeth.
Well, I chose that because mothers do know best. If you have this gut intuition that something's not right with your child, God gave you that for a reason.
Right.
And so I play that song to aggravate my daughter mostly, but because it's so fun. But God gave us our children for a reason. You have that intuition.
Right.
So if you suspect something's not right with your child, follow up.
Right.
Follow up. You see those red flags, and you know your child or your spouse better than anybody else. So.
And don't subscribe to the typical, well, that's just there's nothing we can do about that.
It's normal.
Yeah.
It's not normal.
Yeah.
Yeah.
Well, I think you've given our viewers a lot of things to look for in their own children and in themselves. So we're going to have Kimberly back on our next episode, and we're going to take some common questions that parents come in with after this broadcast and in the past broadcasts, just different questions they have, and we'll together answer those very pertinent questions that pretty much everyone is asking, or maybe they didn't know they should be asking. So Kimberly, it's been great having you. Thank you so much.
Thank you.
This has been Health and Harmony Beyond the Teeth with Dr. Hal Stewart. We will see you next time. In the meantime, be safe, be happy, and be healthy. Bye-bye.